So, without further ado, on to today's speakers. We are so thrilled to welcome Kristen Song, Dr. Deanna Behrens, and Jeremy Stein. Starting with Kristen Song, she became a gun safety activist after her 15-year-old son Ethan was killed with an unsecured gun in his best friend's house. Kristen has worked tirelessly to get Ethan's law passed in Connecticut and is now focused on getting this passed nationally. For those who may not know, Ethan's law would require all guns to be secured if a child or unauthorized person can gain access. Kristen, thank you so much for joining us. On to Dr. Deanna Behrens. She is a pediatric critical care physician at Advocate Children's Hospital in the Chicagoland area. She co-authored the first editorial on gun violence published in Pediatric Critical Care Medicine Journal and was the lead author on a chapter on firearm injury prevention advocacy for pediatric clinics of North America. Dr. Behrens, health policy scholar with the Academic Pediatric Association, continues to work on strengthening gun laws. Thank you for joining us as well. And our last panelist with us this evening is Jeremy Stein. He is a nationally recognized gun violence prevention expert, advocate, and survivor. He served as the executive director of Connecticut Against Gun Violence for the last 6 years, where he helped lead the way for the passage of some of the strongest gun laws in the nation. Jeremy is a seasoned litigator with over 23 years of experience and has a strong passion for reducing gun violence. Welcome, Jeremy. Thank you again for being here. To all of you, each presenter will now have 5 minutes for their own opening statement. So I will first turn it over to Dr. Deanna Behrens.
Hi, all. Thank you so much for taking the time out of your night to be here with us as we kind of discuss different avenues that we can work towards a better future for our kids through safe storage. So as a pediatric critical care physician, I'm often the final pathway in these kids' journeys in the hospital. So we have direct experience in taking care of victims of gun violence of all kinds. We know that it could be suicide, unintentional violence, or homicide. And we've certainly seen all of them in our ICU. And we also know that a significant percentage of those kids do not survive to make it to the intensive care unit. So one of the reasons that this is my passion is that even though this is based in the ICU, we know that this is a public health crisis for kids in the United States. And we need to look at it from different ways. So one of them, we need to look at preventive measures. And one of the biggest things that we can do, and something that we know is effective, is to have more stringent laws about safe storage, to encourage clinicians and parents to have open conversations about safe storage, and for us to work with parents and other people to facilitate some of these conversations and really just normalize how we're talking about that. Here in Illinois, where I'm fortunate to be based, we've been doing a lot of work with the Illinois legislatures about passing safe storage education bills, because we know that safe storage as a message needs to get out there. There are people who want to secure their guns storely and do not know how. In fact, we know that most people, well, all parents want to keep their kids safe. We want to give them the education, the knowledge, and the tools to be able to do so. So we'll certainly talk more about that later, but thank you for giving me the opportunity to come talk to you tonight about some of the ways that we in the medical field can help out with this.
Thank you so much. I will now pass it to Jeremy.
Thank you. It's really a pleasure and honor to be here with these esteemed panelists as well. One of the things that I did as the executive director of Connecticut Against Gun Violence, with the help of many, many people, including Kristen Song and Mike Song and her family, we were able to pass a lot of laws between 2017 and 2023, and one of those was Ethan's Law. And then in 2023, we were able to then take Ethan's Law and turn it from a child access protection law, a CAP law, which we'll talk about, into a more robust, true safe storage law, which now requires in Connecticut the storage of firearms regardless of who's in the home. and why, why was safe storage? We passed a lot of laws, but why was safe storage so important? And we'll talk more about this, but because it works, it's not a political issue. In fact, one of the things is, the NRA even includes safe storage, in their literature when they're, um, uh, when they're training people to learn how to use firearms. Even the NRA says safe storage is something you should be doing. We know it reduces suicide, it reduces domestic violence, community gun violence, and mass shootings. And in the time that I was an attorney and I practiced for about 25 years, I was a litigator, but I was also a prosecutor early in my career. And one of the things that I saw prosecuting cases, mostly gun cases in the District of Columbia, was the devastating effect that the ease of firearms has in a community like the District of Columbia. And something as simple as requiring owners to store their weapons can help to reduce many of the guns that are ending up in the streets, especially in our cities, because many of those guns are being stolen from cars and homes. And so if you require people to store their weapons, it makes it much harder for somebody to then steal it. I'm also a survivor of gun violence in several different ways, and I approach gun violence prevention from that lens a lot of times. And you know, Suicide is certainly something we will talk about. My uncle took his own life with an unsecured firearm. He'd be alive today if that gun were stored. But also, or even earlier than that, when I was in high school, I was at the bus shelter with about 50 other students. We were waiting for the bus, and a man with a mental health disorder came to the bus stop with a sawed-off shotgun, pointed it at me and my friends and about 20 other people. And if it weren't for an off-duty police officer who happened to be there and tackled this, this would have been yet another mass shooting, another person who had ease of access to an unsecured firearm. Once again, this is a common theme that we hear over and over. Safe storage is something very near and dear to my heart. It's simple, it works, and I'm glad to be here, and hopefully we will have a very good conversation.
Thank you so much for sharing, and we are very happy to have you here. And then last but certainly not least, Kristen Song, if you would like to introduce yourself.
Thank you so much, and thank you for having me. I just want to read you something really about the last day that I spent with my son, Ethan, just to kind of bring you into a survivor's perspective. It was just an ordinary morning. I ran around in desperate search for the elusive baseball pants I knew I saw but couldn't find, peppered my boys with questions as they loaded up their backpacks, and added to my never-ending to-do list that was posted predominantly on my refrigerator. Perhaps you can relate. That morning, my son Ethan was getting his braces off, and that was kind of a big deal because he was the poor child that had every contraption in his mouth and seemed to have his braces on forever. After he was freed, we sat in the car and I took a photo of him and texted it to my husband. Look, no braces. It was just another milestone, plenty more to come, right? That would be the last photo of Ethan alive. We went out for a celebratory breakfast, and as he sat munching on his bagel, he shared with me all his hopes and dreams. He wanted to attend Rice University, join the Army, marry, and have 7 children. He was no longer a child, but a smart, confident, compassionate young man who I knew would make a big difference in this world. You see, Ethan wasn't motivated by money or having nice things. He wanted to change people's lives. He wanted to make their lives better. He was my empath. When we visited the Anne Frank house in honor of his grandmother, who was a Holocaust survivor, Ethan pulled the Israeli flag from his pocket, draped it across his shoulders, and whispered, "For Grammy." July 31st, 2018 was actually a beautiful winter day. The temps were mild, the sun shone bright, and the sky was a deep blue. I remember thinking as we left the restaurant that it was a miracle that all 3 of my children were in a good place. All of them were happy. My daughter was loving nursing school. My son Evan was excited to attend Boston College, and Ethan was stepping out of his brother's shadow and forging his own way. For a moment, I thought maybe I was a good mom. When we returned home, his best friend stopped over and Ethan asked if they could walk to his house. I hesitated because it was already 2 p.m. and we were having an early dinner. I told him to be back by 4:30. I heard the boys laughing while they walked out of my home. An hour later, I was walking Ethan's foster dog when I heard and saw an ambulance scream past my street. I had no idea my son was taking his last breaths. Minutes later, I saw 2 officers walking across my lawn and my heart sank. They wouldn't make eye contact with me. They just kept telling me Ethan was hurt and I needed to get to Yale. I texted my husband, 911. When my husband and I ran to the emergency room, it was like the parting of the Red Sea. You see, they were waiting for the dead child's parents. I saw Dr. Katie first. He had performed surgery on Ethan just 6 months ago, and my heart swelled with hope. I thought he was there to tell me Ethan was in surgery, but he would live. Instead, he just stared at me. And so I took off running towards the bays where I knew my son would be. But I was stopped by a social worker who grabbed me by the shoulder and led me to a tiny room where no sunlight ever reaches and where no good news is ever delivered. The ER doctor entered the room, slid down the wall, buried his head in his hands, and just whispered, "Your son is gone." And at that moment, all that I knew, loved, and trusted imploded. I fell to the ground and started rocking in a fetal position, begging to see my son. I wanted to tell him how loved and cherished he was. I wanted to kiss his forehead, and I wanted to tuck him in one last time. But the ER doctor took his head out of his hands and said, "Please remember your son as he was. He's unrecognizable, even to your eyes. He was shot in the head." But the ER doctor didn't understand I was the first person to welcome Ethan into this world, and I wanted to be the last to say goodbye. I never did get to say goodbye. As I walked out of the hospital into the starless night, my son was being wheeled to the morgue. It was the first day of my life sentence and the first day of his death sentence. My goal is to create a cultural shift in this country where it becomes second nature to secure your weapons if children can gain access. I believe child access prevention and safe storage laws will have the most dramatic impact on reducing gun deaths in our children. But as you know, legislation alone will not create this shift. And that is why I'm here today to ask you to partner and hope with me. Your voices are crucial to this movement. I implore every medical professional to lean in, educate, advise, lecture, and publish about the importance of safe storage. Come and lobby with me. But please come off the sidelines, ask the hard, uncomfortable questions, be unapologetic, because at the end of the day, a child's precious life is at stake. The CEOs of the hospitals need to lead, as do the local and national medical associations. We all have to treat the #1 killer of our children with urgency and remember that the Second Amendment does not negate a gun owner's personal responsibility for their lethal weapons. So I hope when you are faced with an uncomfortable situation, have to ask tough questions, fight for new procedures or policies in your offices or hospitals, and you hesitate, remember the broken mother you heard once speak. Better yet, remember Ethan. And never be afraid to save a child. Thank you.
Thank you so much for sharing, Kristen. And I really hope that that story and hearing that from you can inspire the many physicians, medical students, and just everyday people on this call attending this advocacy ground rounds. So thank you again. Thank you all for being here. We're going to start off this panel session with some prepared questions that we have. So this will spend about 20 minutes with these questions and then open it up to the Q&A from our attendees. So this first question, just to kick things off. So who needs to know about safe storage and how do we have conversations about safe storage? So whether it's parents to their kids, physicians to their patients, or vice versa, patients with their physicians. And whoever wants to start with this one, you're more than welcome.
Thank you so much for the question. And Kristen, thank you so much for sharing that story. One thing that I do think is very important is to center the lived experiences of people like you and your family who have gone through all of this. And remind ourselves, like you said, that we don't want any families to be going through this in the future. One way that we can do this is to destigmatize talking about guns. Sometimes people are scared to talk about guns or hesitant to talk about them. And sometimes physicians are hesitant or don't know how to talk about safe storage and guns with patients. This could be in the outpatient or in the inpatient world. I think that it's important for physicians to know that children who are toddlers, even children who are toddlers, have the strength to pull a trigger. So no age is really safe from guns, and there is no age that's too early to start talking about guns as a preventative safety measure. It's important for us as physicians to let families know what is the best way to store guns safely, why it's important, which is that any kids are curious, kids know where guns are, even if you think that they don't. It's important for you to know that your kid, if you have a gun, might know how to get it and might know how to use it. We also want them to know that we know that even people who are gun owners, especially people who are gun owners, have a vested interest in keeping kids safe from guns. A lot of people see guns as a tool for everyday use. A lot of people see guns in various different ways. And we're not trying to say that they are not able to keep their kids safe, because they are. And there's lots of methods that we can do that with. So we encourage pediatricians, family practitioners, anybody who sees children on a regular basis to start talking about this early, to mention, hey, do you have a gun and how is it stored? We recommend strongly that the safest house is a house without a gun. But if you do have a house and a gun, it's extremely important to keep guns locked and ammunition separately locked and stored, so that the time that it takes kids to get in it is certainly lengthened. We want to put as much distance and as much difficulty as possible between kids and guns. And again, it's important to talk about this even when kids are little, in the same way that we would talk about making sure they wear their their safety belt, in the same way we would talk about making sure that they wear a life jacket, because this is important and this is something that kids will get into being kids. I can't tell you how many times in the PICU we have kids who take medicine that they didn't intend to, or to do whatever. They're going to find it if it's in the house, or there's a possibility that they could find it. And then it's also important for us as pediatricians to not just talk about it, but there are ways for pediatricians. There's lots of ways through different states. For instance, in Illinois, different hospital systems can ask for funds or direct locking devices from the Illinois Department of Public Health, so that we can pair this message about guns and gun safety with the actual product to do so safely. And we don't want any financial barriers to let people help store their guns safely. So if we can pair that with the safe storage message, that's the best way to do it. And then also to normalize encouraging our patients to ask other parents the same questions and to talk to their kids about that, all in age appropriate ways.
Yeah, just to follow up on a couple of things that Dr. Behrens had said. The answer to the question about who should know about this, it's pretty simple, right? If you listen to Kristen's story, and unfortunately her story's not even unique, right? Everyone needs to know about safe storage. That is the answer to that question, right? And we do need to normalize it. And so how do we do that? How do we have these conversations? And as Dr. Barron said, we need to normalize having these conversations. One of the things that we see all the time is this idea of, well, if we just tell kids to stay away from guns, right? Well, that's enough, right? Or if we just educate them, that'll be enough. And it's just not true. And if you look at the data and you look at the research and you look how the human brain is formed, and young children do not have a developed prefrontal cortex that allows them to make those kinds of decisions. And there's been study after study to show that, like, if you tell kids no, and you put them in a room full of guns, like, they will play with the guns. It just, they don't have the ability to make those kinds of executive decisions. So storage is what has to happen in order to make sure that kids don't have access to firearms. And the belief also that, oh, well, it's hidden in the home, or it's in a box, they'll never find it. They'll find it. Kids are resourceful. They know where things are hidden. And we've all seen this time and time again. One of the most chilling things that I saw as a prosecutor, and it was something that Dr. Behrens had mentioned, was, had that kids, toddlers, can still function firearms, even though they might not have a lot of hand strength or coordination. And one of the things that we learned was when a toddler has access to a firearm, they may not have enough hand coordination or strength to pull the trigger with their fingers the way people normally pull a trigger with a gun with their index finger. However, if you watch a toddler, if you watch an infant, if you watch them manipulate objects, they use their thumbs a lot. Like, their thumbs are the strongest part of their hand at that point. And so in order for them to manipulate a trigger, they will use their thumbs like they do with every other object. The only problem is, in order to pull the trigger with your thumbs, the gun is going to be pointed directly at your face, which is why those are almost always fatal. But all interactions with firearms, we know, we know the access to the firearm is what makes things fatal, especially when we're dealing with suicide. Access to firearms, access to people who are in crisis, that kind of access when people are in crisis is almost always going to end up as a fatality. So I think I'm really grateful that we are having this conversation here, that this is a platform where physicians can learn more about how to kind of thread this needle of talking about safe storage. But I do agree with Dr. Behrens that it has to be normalized.
Yeah, and my entire community really is now survivors. And I can't tell you how many moms and dads I've spoken to whose children have died by suicide with their unsecured guns. And the first thing they say to me is, well, two things. One, they say, I had no idea my child was in crisis. And number two, they understood the power of a gun. They were taught gun safety. And, I just have to remind these parents that when your child is in crisis, it doesn't matter what you have taught them. That is the furthest thing from their mind. The only thing on their mind is, how do I get out of this pain? And how do I do it quickly and successfully? And unfortunately, with teen suicides now tripled, guns are the go-to.
Thank you all for your insight on that first question. I know it was kind of a heavy one. Moving on, related, if you guys could give examples of various laws that exist in states, because Doctors for America, we have members across the nation. So what kinds of various laws exist in states regarding safe storage? So whether it's child access prevention, recklessness versus negligence, red flag laws, any specific ways to store your guns.
Sure. So there's a lot of different gun laws, but in relation to safe storage, I think the two main laws that you need to know about are what the difference between what we call a child access protection law, also known as a CAP law, and a safe storage law. And child access protection laws, CAP laws, basically, there are different forms of them. But in the simplest form, it is, if you have a child or some other vulnerable person in the home, then that law would require you to store a weapon. And the difference is that a CAP law normally does not require you to store the weapon if you live alone. Normally does not require you to store a weapon if you have adults in the home only. Why is that a problem? Because of theft, number one. Number two, sometimes people visit home. Sometimes people stay over home. Sometimes people have access to other people's homes. They go over to their friend's house. And so that is why, like, CAP laws are great. But what's better is a true safe storage law that requires you to store your weapon no matter who's in the home, because you never know when there's going to be a child in the home. But also, it's not just children that have to be protected from firearms, as Kristen had said. It's also vulnerable people in crisis who, if they have access to a firearm they may make a very impulsive decision. And sometimes the difference between life and death is having a weapon that is stored, or having to remember what the combination is to a safe, or finding the key. Like, those critical moments might be the difference between life or death. And, people on the other side are always saying, well, why do I need to store a weapon if I live alone? This is my right, et cetera, et cetera, et cetera. And, the thing is that storage of weapon doesn't have to be a giant safe. It can be something as simple as this. This tiny safe can store a weapon with very quick access, or something like this, which is not the most ideal form of storage, but it's still something that can prevent access. Is just a simple lock that's almost like a bike lock. And even those things are better than just leaving it in your nightstand.
Thank you. I think this next question, I think Kristen can answer a little more efficiently. So how would a federal Ethan's Law legislation look?
Well, we honestly, when Senator Blumenthal and Representative DeLauro were looking at creating a Ethan's Law nationally, they really went to the NRA's like guidebook, just like Jeremy said, and they really just mimicked it off of what the NRA has said, except that they stopped short of telling people that they have to store their ammunition in a separate safe. So the NRA and the NSSF are the two organizations that fight Ethan's Law down in DC, and they're the two organizations that promote safe storage in a much more strict fashion than Ethan's Law even requires. So it's very puzzling to me that they spend so much time and money paying lobbyists to fight Ethan's Law. But the goal for Ethan's Law, because so many states do stand silent on this issue, and a lot of the red states will probably never in the close to near future pass, a safe storage or a cap law, is really just to create a national just framework so that we can now start creating a cultural shift in this country. When I tell my kids don't drink and drive, they look at me like I'm crazy. When I was in college, drunk driving was socially acceptable. It was. And so now we've come to that cultural shift where it's not socially acceptable, and there's repercussions and there's consequences for your actions. And that's really the same fantasy, same goal, same object I have for a cap law or a safe storage law nationally, is that we get to a point where, our children are asking us, like, are you kidding me? People used to just leave their guns around and that was like socially okay. That was, there was no consequences. In my case, the negligent gun owner did not even suffer a fine. He had zero consequences. In the eyes of the law, my child meant nothing. And so that is the shift that we are trying to get to, is to prevent mothers like me sitting on panels like this, sharing with you the fact that we will never be the same. My family will never be the same. I don't want you to be, I know that sounds very cliche, but I don't want you to be me. I don't want to meet another survivor. Because at that point, it's too late. So that's really was our goal for Ethan's Law, is just to create this shift in this country.
Thank you. Switching gears just a little bit, Dr. Behrens, how do you have conversations about safe storage in the clinical setting, or how do you suggest those conversations might go?
Absolutely. Thank you for bringing that up. And looking at the Q&A, several people have questions about that as well. So I did want to point towards one resource that I put in the chat, because this is something that I'm happy to talk about for a few minutes, but there's a lot of education and resources out there. And the best way to get comfortable with this is to practice, just like we tell parents to practice talking to other parents or their kids about this sort of thing. But the AAP has a free PediaLink site that I put again in the chat that teaches physicians and pediatricians how to talk to families about gun violence, and it has different scenarios and different ways that you can talk about it. I think one of the main things that I say and that I teach the residents in my program is to make it an ongoing conversation. So start it early, start it in their first year or two of well child visits, and to continue that as a conversation, just like you might with the family that has vaccine hesitancy. It's part of our jobs as physicians, and I appreciate so much everybody who's on here to learn how to do this. It's part of our job as pediatricians sometimes to bring up conversations about things that are maybe not quite so comfortable with us. And part of the way that we get good at doing this is practicing, is looking for resources that will help us do this sort of thing. Again, you can see in the chat that I put the website link to the AAP. It's called Safer Storing Firearms Prevents Harm. And that's a free PediaLink course, I think, but I'm not 100% sure. I think that you can get CME credit for that as well. But the things that we really want you to talk about, and if you look in the AAP policy guidelines on this, the things that we want physicians to talk about our anticipatory guidance. So again, starting it early, having ongoing conversations, letting them know, and I know this sounds like a broken record because we've talked about this a lot, but the best way to store guns other than out of the house is to store the firearm unloaded, locked, store the ammunition separately from the firearm, and store the ammunition locked separately from the firearm. I also want to point out that when I say the safest place to have or the safest home for a child is a home without a gun, that doesn't mean that people can't still own guns. There are plenty of people who have guns that store them in other locations as well. So certainly, I'm not saying that that's not possible, but it is important. Then we want to talk about it in an age-appropriate way. So if you have a very young child, you want to make sure that you're saying things like, listen, you wouldn't leave a child home alone with unsecured medicine with unsecured caps. You wouldn't leave them with the hot stove there. You wouldn't leave them with all of these other things. And in the same way, you need to be protecting your child from unsecure guns. As they get a little bit older, it's important as they start going over to friends' houses and have play dates to ask the child, what would you do if you have a gun? Who would you bring it to? Who would you talk to about that if you happen to find a gun? These are not foolproof methods. These are things that we can do to try to make kids safer, but these are not foolproof methods. However, what we can do is to continue to have those conversations. And as they get to be teenagers, making sure that families and teenagers know, one, again, if you are at a friend's house and you see a gun, what do you do? How do you deal with peer pressure around that? How do you get yourself out of those dangerous situations? And pediatricians do have resources for that. And we do have stuff that you can use in each of those different scenarios in that safer storage module that I posted online, or you can look at healthychildrens.org or all of those sorts of things. From a physician standpoint, I do think that if you haven't done it before, it can be a little bit awkward those first couple of times to start doing it. Just like it's awkward sometimes for people to start talking about drugs or alcohol or tobacco or sex with kids. We know that those are all pose some risks to kids, just like we know that guns pose risks to kids. And by dealing with it within a matter-of-fact way, that can help you and the patients kind of treat it as a normalized subject and something that we can work together, parents, families, kids, and pediatricians, to help keep all kids safe. I just wanted to say two real quick things. I liked what Kristen said, or one of the things that Kristen said was that, or alluded to, that gun violence does not just affect the child, it affects the family and the community. And we know that gun violence is an inequitable disease as well. We know that it affects different genders, it affects different ethnicities and backgrounds and different socioeconomic conditions, those in marginalized socioeconomic conditions differently. So it's important to think about what your patient population is and what the makeup of that is to be able to talk to people about that in a culturally appropriate way. And I just saw the Q&A blowing up, so there might be lots more questions. You also all have my email, so please, please, please feel free to reach out to me after this. I can talk to you. I can even come and do like a little Zoom if you have a residency program or something that you want to talk about. I'm happy to do that. And there's also a new AAP firearm and injury prevention special interest group that is also very, very helpful.
Thank you so much for sharing all that. I mean, especially personally as a medical student about to go on rotations, I just think all of what you said is so important and really just destigmatizing talking to our patients the same way we talk about bike helmets and seat belts. And that's just so important. So thank you so much. Um, I think maybe part of why physicians might hesitate on this is they think they can't talk to their patients about guns. So Jeremy, if you could touch maybe a little bit on the Florida gag law. Oh, sorry.
Sorry, I just wanted to say one thing. As I'm looking in the chat, it's saying that they can't see things in the chat or resources that I've posted in the chat. I don't know from a behind the scenes thing, if we can put that on for people. Or it is, I can send it to you to put it in the document that you will send out to.
Okay. Yeah, I'm sure we can get that figured out more behind the scenes. We only have a couple more minutes left for our these questions because I do want to move on to some of the questions asked in the chat. But Jeremy, if you could touch a little bit on the Florida gag law, that maybe people think would prevent them from having these conversations in the first place.
Yeah, one of the interesting things before this panel, there were some like screenings that were done, and there were a lot of questions about gag laws from physicians. And I want to start by kind of answering one of the questions that's in there, which is somebody brought to the attention that firearms is the leading cause of death of children in the United States. And young, it's not just young children, it's teenagers and young adults as well. And I think that is really important to frame the importance of gag laws around, how do you deal with the fact that this is the leading cause of death of children and you're a physician. And we've seen, I think that the APA and other organizations have said, like, physicians, social workers, psychiatrists, like, should be talking about safe storage because it affects children. It is a public health crisis. So to not be able to talk to your patients about whether or not they have a gun and what kind of safety measures, it's like anything else that a good physician, nurse practitioner, APRN, health provider would do, is to do a screening, to talk to their patients and to assess what kind of situation they have and what home is like and what do they need, and do they own a gun and do they need to store it? If you have a child, you need a baby seat, you need certain things, right? If you have a gun, you should have a way to store it and to not be able to talk about it. So what is a gag law? It is exactly what it sounds like, and it's really surprising that these kind of exist. But what happened was there really was only one state to try to do this, and this was Florida, of course. And this was back, I think, in 2011. Florida created what was called the Firearms Owners Privacy Act, or FOPA. And the way that this kind of evolved was the doctor said to the patient, said, "Hey, do you own a firearm?" And the mother she was there with pediatrician, child in the home, said, do you own firearm? And she said, I'm not gonna answer that. That's none of your business. And then the pediatrician said, well, I'm gonna give you 30 days to find a new pediatrician because if you're not gonna answer a simple question like that, I can't be your pediatrician. And so then a lawsuit was filed, and then off to the races. And what ultimately happened, is kind of it was like docs versus Glocks in this case, right? And at the end of the day, what ended up happening was this law that was enacted, the Firearms Owners Privacy Act, prohibited doctors from asking their patients whether or not they own guns. And it also went a little further than that and said you can't discriminate against patients at all just because they own a firearm. And ultimately what happened with this law is the court struck it down. And the reason why they struck this law down was mostly around the First Amendment, right? So it is interesting that we always talk about the Second Amendment, the right of someone to have a firearm. But oftentimes we see the Second Amendment trample on the First Amendment, which is, the right of people to freedom of speech, freedom of religion, et cetera, freedom to vote, freedom to assemble. And so these laws don't really exist anymore. Florida was the only state to do it. There isn't any state that now has a gag law, but there are other states like Missouri and I think Minnesota and Montana that have kind of set up their own laws that say basically you can't discriminate against people because they're firearm owners, or you can't use certain software or certain things or funding to prohibit people, or to own a gun, or to force people to have to store weapons or to have to answer questions. So right now there isn't any state that has a true gag law, but there are states that have laws that may limit what you can do in a practice or what you can use. However, that doesn't mean that this can't change. And I think this is one of those scenarios where like voting really matters, and that the makeup of the Supreme Court really matters, and the law changes. And so these are kinds of things to watch in your state. You cannot sit idly by and just fall asleep and let a gag law get passed in your state, when especially if you're a physician or you're a mental health provider, or healthcare provider. This could have serious ramifications in your practice, on your ability to treat patients, and your ability to save lives. The number one killer of children right now is guns, and if you can't talk to people about guns, then you are limited in what you can do. Lastly, I do want to touch on one thing that we forgot to mention, which was the red flag laws. And just briefly, if you're not familiar with the red flag laws, it's also known as an extreme risk protection order, or ERPO. And these are laws that Connecticut has one and New York has one. And basically what it does is it allows the courts to issue an order similar to a search warrant or an arrest warrant. And it allows the court to issue an order in an emergency situation where someone is at imminent risk to harm themselves or others. And it allows the police to go in and confiscate guns in that type of emergency situation. So these laws are incredibly important, tying in with domestic violence laws and safe storage laws. And it's important to know like what the law is in your state. In addition, there's an additional conversation that we could have just around, I think it's Tarasoff laws, which are laws that not only that some states mandate reporting, right? So if you have a client's patient who is at imminent risk to harm themselves or a third party, some states allow you to breach confidentiality and report that to the police. Also report to third persons to make sure that they're safe. But there are other states that require it. There are some states that actually require you to do so if you are a mental health provider and you know of a patient that has the ability to harm someone and has made threats, and those are viable threats, and they have the ability to carry it out. Some states actually require you to report it not only to the police, but also require you to warn a third party. So it is really important to understand what the laws are in your state, and if you're a hospital administrator, to make sure that your staff knows what the laws are, especially if you're a mandatory reporter.
Thank you so much for sharing all of that. I think it helps give a more well-rounded view to maybe why some physicians may not feel comfortable talking about such an important topic. We are kind of coming to the end of our time, and it would be remiss to pass on this question. So before we move on, I know we have so many excellent questions from the attendees, but just for people to take away from this, maybe I know it's quick, but how would you advise physicians to advocate for safe storage, either at the federal level or at their state and local level?
Yeah, so I saw a couple of questions in the chat on there as well, and I think that there's a couple of people who have their hands up about that as well. So I'm active in advocating for this on the state and the federal level, and there's different resources that you can use to do that. So certainly an important thing to do is to reach out to whoever your elected official might be and just call them and say, I'm a pediatrician, I'm a family practice physician, I'm whoever. What is your stance on safe storage? And then there are resources that you can do to provide different things about what makes it important for them. Somebody asked in there, how do you find out what your state's laws are? So if you go to websites like Everytown or Giffords, they certainly have like maps that have all of that, and so does AAP. So knowing what your state's background is, knowing what you would like to have, what you're advocating for, which is safe storage is going to help save kids' lives, and knowing that pediatricians or other physicians have the power to combine stories with data-based research to the best of our ability to talk to not educators, but legislative officials about this and continue to push this forward. I have lots of other advice for that, but we have a limited amount of time. So again, my email is in the chat or the initial email.
Yeah, and I want to give a shout out to Joanna, who asked a question about advocating. Joanna from Moms Demand Action, who I sat in the Senate of the Connecticut Senate until 3 a.m. waiting for a safe storage bill to be passed. How do you advocate for this kind of stuff? And I think that Dr. Barron's kind of hit the nail on the head in the beginning, which is like to normalize, right? And I think anything we do to promote safe storage is good, right? So that means putting it in your practice, asking your physicians, like if you go to the doctor as a layperson, if you're seeing your doctor for a routine checkup or whatever, ask them, hey, is this something that you do in your practice? The other thing that you can do, which is quite simple, is brochures lobbies are filled with brochures, and a strategically well-placed brochure about safe storage in the lobby of your physician or nurse practitioner or whatever, goes a long way. I mean, and I can't tell you how many times people kind of miss that opportunity to advocate, where it's just it's the places you go as on a day-to-day basis, whether it's a psychologist or a physician or pediatrician, and you're there, and you can just bring a couple of brochures that you might have and say, hey, here's a stand, here's a brochure, can I just leave these in your lobby? Can you, or contact hospitals and do it. And we did this all the time, trying to get as much knowledge in the hands of as many people as possible. The other thing that you can do, it's not just like physicians and doctors' offices and nurse practitioners, it's also schools. And it is really important to make sure that we are educating our children about this, because that's where it starts. And so to make sure that we are also not missing that opportunity to talk to schools and to have principals and school boards and emails and letters sent home that are going to promote safe storage, or having a safe storage day where every year there's like, hey, check the batteries in your smoke detectors. Like everybody does that, right? Why don't we do that of check to make sure like there's batteries in your safe, or that your guns are locked up, or et cetera, et cetera. So I think, normalizing it and making sure that in addition to passing laws that mandate this kind of thing, which you could do, I think you don't necessarily need to do that. I think the first step you could do is just talk to the people that you are around on a regular basis, whether it's physical therapists, physicians, et cetera, and make sure that they are practicing what you are advocating for.
I see. I think some of the things going into the chat look like they're just going to host some panelists, so I think we can hopefully figure out a way to get this information to the attendees. Moving on to some of the questions in the chat. I know some of them were kind of touched on in other questions, and we only have a few minutes. I guess panelists, were there any that you wanted to touch on with the remaining few minutes? If not, I can choose one.
Just looking at a couple. So one, absolutely for everybody who mentioned that we need to keep the word out there that this is a public health crisis and that it's the #1 cause of death in kids. That's an incredibly effective way to kind of go about this issue. The other one is to partner with your personal hospital or your health department in your local community, or reach out to other advocacy organizations to partner with them, which is helpful. Two, well, I already said one. I don't even know where I'm at, probably more than two. Another thing to do to get the word out there is to write things like op-eds. So there's a lot of op-eds that are available, including one that I just had published in the Sun-Times yesterday. So if anybody's interested in writing op-eds, please feel free to reach out to me. There are a lot of people had put in the chat things about like Be Smart for Kids, all of this sort of stuff, just kind of looking through there. And I think somebody did have their hand up if they wanted to ask a question. I don't know what the protocol is for you guys. Keisha, would you be able to help? How do we allow somebody to ask a question?
Yes, I have clicked on the person's name and asked for them to unmute if they would like. Ram. Oh, okay. We'll continue.
One of the questions that he had specifically asked, or she, I don't know, in the chat was what data and metrics have been presented to state representatives and senators. There is actually some research available on this. Things like we know that states that have stronger child access prevention laws have decreased mortality in children. We also know that states, even if you have good gun laws, if your state is surrounded by other states that have not very strong gun laws, that mortality and morbidity bleeds into even states with stronger gun laws like Illinois. We also know that there seems to be an association between reduced mortality and morbidity for children specifically. And I know I'm talking a lot about kids, by the way, but I'm a pediatrician, so that's why. We know that there's studies that show that states with stronger gun laws tend to have less morbidity and mortality due to guns in kids. And then treating it as a public health crisis, we have successfully reduced deaths due to motor vehicle incidents, smoking, drowning, all kinds of other things. And I think that we can do it for guns too if we have a lot of consistency, a lot of persistence, and a collaborative effort.
Oh, I don't know if it's just me, Jeremy. I can't hear you. I don't know if anybody else is having that.
I accidentally hit the mic, mute button on the mic. There were a lot of questions about liability and holding people responsible and insurance, and these are all like tied in, so I can kind of tie this in a nice bow. We saw very recently Jennifer Crumbly, who was just convicted of manslaughter, and I believe she's the first person to ever be convicted of a crime that their child committed, right? And or you know, our child committed a mass shooting, and she also committed a crime for negligently allowing them to have the gun. And so I think we're going to see more of that. We also saw liability with we saw huge settlements with the Sandy Hook lawsuit, and we've seen more willingness on the part of juries to hold people responsible. So I do think that is something that's going to happen. Connecticut has laws in place which states can do. In addition to having mandates for storage, they can also add a law like Connecticut's, which says If you don't store the weapon and someone gets a hold of it and commits a crime, then you are now civilly responsible. You're strictly liable for the damage as well as committing a crime. So, it's a double whammy. In addition to that, insurance, we are seeing states try to push laws, try to advocate for laws that are going to either mandate insurance or at least bring insurance into the picture. And I do think, although it's difficult, I do think that if you were going to change people's behavior, I think civil liability is one of those ways that you can do that, right? So sometimes more than criminal liability, criminal responsibility is, why do people shovel their walks when it snows? Because people are afraid that they're going to get sued of the mailman or somebody slipping and falling on their sidewalk. It's not because they want a clean sidewalk or they want to do the right thing. It's because people are afraid of getting sued. And if you can incorporate insurance, or liability into that somehow, in the same way that someone's rates go up if they, have certain health problems, or they live too far from a fire hydrant, or they live in a flood zone, like their homeowners insurance rates go up. Why is it that your insurance rates don't go up if you own a gun, when we know that there is a similar type of risk? If you have a gun in the house, we know that your risk of suicide, domestic violence, accidental death, homicide go up. So having a gun in the home increases risk, increases the chance of fatality, yet it's not really a factor by insurance adjusters, and it's a mystery why that hasn't happened yet.
We are at the top of the hour, and I do want to be respectful of everybody's time and the rest of their evening. So I think that will conclude the Q&A. Thank you all for your questions. If we did not get to your question, I believe some of them, Dr. Barron said that her email is available if you have further questions specifically on advocacy. But at this time, I would like to close today's event by once again thanking our speakers for this thought-provoking discussion, and thank you to all of our participants for joining us. Before you leave, a couple of quick reminders. The recording of this presentation will be sent out along with the resources shared by tonight's speakers. We'll try to figure out what happened with the chat situation. And then thank you again, once again, for being here. We hope you'll become an official Doctors for America member today. Take a look at the benefits on our website. And once again, thank you for attending.